I've started to see news articles crop up about this new study that looked at steroids and talked about how they disrupted brain activity. But let's talk about what the study actually found and what it means and what it doesn't mean. First, they looked specifically at what are called glucocorticoids, which are those steroids that we commonly use for things like allergies or asthma and can be taken via inhaler or pill or even a shot. And I'm going to tag the great Dr. AJ here, Silver Sage, in case he might be able to speak more to the use of these medications, side effects, stuff like that. Neurologically speaking, what they found was first a change in what's called gray matter volume. Gray matter is what shows up on the MRI representing the cell bodies, the actual neurons in the brain. And they found that gray matter volume seemed to increase in an area called the caudate and decreased in the amygdala. They also found what's called a reduced white matter integrity, and I'm not going to get into the details of how that's measured, but basically the concern is that the interconnection between neurons is in some way disrupted by these medications. But what does all of this mean? Because that sounds really scary. Well, the reality is that the level of change observed appears to be related to things like increased psychiatric effects, depression or anxiety, as well as some effect on potentially things like memory or restlessness. But we're also not talking about long-term memory deficits like you might see in Alzheimer's or forms of dementia, but rather working memory difficulties in the moment while on the steroids. What's also important to understand is that they could not confirm that this was even caused by the steroids, because often individuals who have inflammation, which is what these help deal with, also have these psychiatric issues as well, because we do see a relationship between brain inflammation and a lot of the symptoms we're talking about here. Further, even if the steroids are causing it, because there is some evidence they might be, there is not evidence to suggest that it is long-term and permanent versus a symptom of being actively on these medications. In other words, when you stop, there is not evidence to suggest that the symptoms won't go away as well. Also important is there was a huge difference between groups taking really strong oral steroids and those who, for example, were just using inhalers, where the effects were much, much smaller. So in summary, even if you are using one of these medications, the conclusion of this study is not to stop, but rather to make sure that you and your doctor keep an eye on some of these symptoms in case an alternative might be useful, and not to go and freak out and worry that all of a sudden these medications are going to cause some long-term, permanent, deleterious effect.